I am David Agus, Professor of Medicine and Engineering at the University of Southern California and author of The End of Illness. Today, I'm going to talk about some new ideas as well as some myths with regard to health.
Baruch here with genConnect.com, talking today with Dr. David Agus, whose new book, The End of Illness, has already been on the New York Times bestseller list for 4 months. How you doing, Dr. Agus?
I am doing great. Thank you so much for having me.
Thanks for being here.
It's great.
In your book, The End to Illness, you really offer a new way of looking at illness.
Yeah, to me, diseases are verbs, not nouns. You're cancering, you're heart diseasing. So I don't want to give you one thing to change one aspect of you. I want to change all of you, from a cancer state, a heart disease state, to a health state. And I really believe the way we make an impact on disease is preventing it, and I think we can.
What are the top 3 to 5 ways that we can start to prevent disease today?
One is block inflammation, which sounds simple, but things as simple as you running all day and your knees hurt, that's bad. You got to figure a way not to. If you're wearing shoes that hurt you, wear shoes that don't, because that hurt is inflammation. At the same point, get your things like your flu shot. If you skip your flu shot, you'll be fine, right? 5-6 days being sick, and then you go back to work. Hopefully you don't go to work and spread it. But 10 years from now, the inflammation from the flu is going to cause a problem and increase heart disease and cancer. So I want you to think about not just today, but tomorrow. And the last thing is real food. Stay away from vitamins, supplements, and pills. Eat real food and do it on a regular schedule.
What are the biggest mistakes that people are making today that they actually think are helping their overall health?
Well, one is vitamins, right? We spend more on vitamins in our country than we do on medical research. And if you look at the data, a man who takes vitamin E, for example, increases his risk of prostate cancer by 16 or 17%. And it lasts 3 years after stopping. That was a $250 million study from our government. Women who take high-dose vitamin D increase the rate of bone fracture. There's no data that multivitamins help with prevention of disease at all. Yet we do it all the time and they cause problems. So the key is real food.
So there are no vitamins or supplements at all that we should be including.
Well,
on a
there are
regular basis.
exceptions. Women who are pregnant need to take prenatal vitamins.
Right.
Right? You know, if you have a particular eye disease, certain things may help. But in general,
The
no.
multivitamin.
63
vitamin C
studies in the history of
packet.
mankind randomized with multivitamin and placebo that are large enough, power enough for the government to look at. None showed a benefit.
Wow.
Many of them showed detriments and health problems.
Wow. Dr. Agus, definitely offering a very new perspective. Thank you.
Thank you.
And for more with Dr. Agus and to learn more about his new book, be sure to check out genConnect.com.